Hello and welcome to my YouTube channel. My name is Michelle Gettens, and this video is going to be one of my first videos focusing on health and wellness. I'm a pharmacist. I graduated from the University of North Carolina at Chapel Hill 15 years ago. So I've been a retail pharmacist for 15 years. I currently work at Publix. I've been there for 6 years now, and I love my job. I love helping patients. I love helping people. I love anything health and wellness, fitness, nutrition, obviously medications and supplements, and I want to share that with the world. So I thought I would begin my first video on health and wellness talking about what we are all dealing with right now in our country, COVID. I wanted to, as our country is opening up, I wanted to bring to everybody some practical information that we can use so that we can live our lives safely, but also live our lives and not feel trapped. So I'm going to share with you some of the things that I do and share with my family and with my patients so that we can live our lives and enjoy ourselves, but also be safe. So the first thing I want to talk about is obviously hand washing. Hand washing is super important. I hand wash often, especially when I'm at work. When I'm at home, I do it as soon as I come into the house, and if I leave and then come back into the house. But at work, I do so every probably about 15 to 20 minutes, especially if I switch positions from where I'm standing at work. I definitely use hand sanitizer. Hand sanitizer at 60% alcohol or more is going to be what is effective. And I do that again anytime I change position or touch something. I do not wear gloves. I think gloves give us a false sense of security. I definitely just use hand sanitizer and hand washing techniques. So of course the hand washing technique is 20 seconds thoroughly washing your hands, especially for us women getting under the fingernails. Bacteria and viruses like to hide underneath there, so I pay special attention of washing underneath my fingernails when I'm washing my hands. Secondly, I want to talk about face masks. I know this is a big controversy in our country right now, but I want to let you know that anything that I recommend, I do so with the backing of research. I spend a lot of time in my education learning how to analyze research and how to read research. So anything that I recommend to you will be backed by evidence-based medicine and research. So if you have any questions about anything that I talk about, please feel free to ask them. I will also attach any documents and references that I feel will be important for you to learn about and share. So anyway, masks. We have the cloth mask, which most people can make or purchase or find now. You want to wash it after each use. So I recommend having 2 to 3 masks so that after you used it for a day, you can put it, you can wash it and use another mask while it is being washed. So definitely want to wear it around your mouth, have it cover your nose and your mouth, nice and snug. And when you're removing it, you never want to touch the front of your mask. When you're using it, you never want to touch the front of your mask. That is what is going to be contaminated. So you always just want to touch the ear loops. This is another mask. I see people wearing this incorrectly all the time. The blue is always on the outside. You put it on. There is a metal mechanism here that is used to help shape it to your nose. And then this stretches to go underneath your chin. I oftentimes see people like this, and it's not protecting you. So you want to keep it under your chin and snug to your nose. Again, do not touch your mask while it is on. You do not need to remove your mask down when you're talking. Obviously, you can hear me through my mask. So lifting or putting your mask down to converse with somebody completely defeats the purpose of using your mask. Again, if you want to remove it, always by the ear loop. Before you remove your mask and before you put on your mask, you always want to hand sanitize. So it's always going to be hand sanitize or wash your hands, put on your mask. Hand sanitize or wash your hands, take off your mask. I do recommend wearing your masks. It does not have to be all the time. So one of the things that I'm going to attach to the bottom of this video is a good article that presents some very nice information and studies that have come from China, where this originated, that had some studies regarding contact tracing. and where masks were the most effective. So basically, you catch this virus by being in contact with a high concentration of the virus over time. So the situations in which you definitely want to wear a mask is when you're in a public situation where you cannot maintain a social distancing of 6 to 10 feet, and you will be in that situation over a period of time. So the grocery store, when you are going to be out and about, any kind of shopping where you're not able to maintain a distance of 6 to 10 feet, and you will be in that place for an extended period of time. Where you don't need to wear a mask is just outside. If you're going to be going for a walk, if you're going to be in a situation where you're in a park and there's people around you, but they're a good 6 to 10 feet away, you do not have to wear a mask. You're not in such a concentrated area to where if someone coughs or sneezes, it's going to stay in one spot for you to catch enough of the virus to create disease. Another thing that I would think about is just each scenario that you're in, you can judge for yourself if a mask is necessary. So, for example, went to take my car for an oil change. In the office where we had to pay for it, it was an enclosed space. There were 3 gentlemen in there before me. I decided when they left and I went into that office, I would wear my mask. I was not wearing my mask in the service bay where the doors were open, it was open air, and nobody was within 6 to 10 feet. It was not necessary for me to wear a mask there. So I will not be going to restaurants inside. It has been proven that the ventilation system can make the virus go from one side of the room to the other side of the room. So restaurants and in enclosed workspaces where you are next to a group of people and they are within 6 feet of you for a long period of time. So I do wear my mask at work all day long. And that's why they see the outbreaks in these factories and in call centers and in restaurants, is because people are for a prolonged period of time within 6 to 10 feet of each other, and then there's the ventilation system that can carry the virus from one side of the room to the other side of the room. So that's pretty much my advice on masks. I choose to wear a mask to not only protect myself, but to protect the people around me. Obviously, we all know that people can be carrying this virus and not know it. They can be asymptomatic. So the last thing I want to do is to be asymptomatic and carrying it and inadvertently give it to somebody around me. So that is, I feel and believe that it is our responsibility to wear masks until we get a vaccine and some proper treatment. And I just really don't want to get sick. So the next thing I am going to recommend are supplements. There are so many things going around out there about what you should take to prevent or treat COVID. And in actuality, there is nothing that's actually proven. It has not been around long enough, and there have not been enough good clinical trials to actually prove that anything prevents COVID. However, there is an abundance of information and evidence out there that shows that there are supplements that can help boost your immune system and your immune system's activity to help combat bacteria and viruses. And those 2 things that I'm going to talk about today are vitamin D and vitamin C. What is recommended for vitamin D is 3,000 to 4,000 international units a day. So what I normally recommend is 1,000 international units per day. It is a mid-range. You can overdose on vitamin D, so 1,000 a day is enough to give you what you need, but to not overdose. So my family has been doing this for years. It's what I've known that helps boost your immune system, and I'm sure you've been hearing it over the media that vitamin D has been helped. There is a small study that has come out in the Nordic countries that has shown that they have shown a relationship with people who have normal vitamin D levels and less morbidity rates, whereas people who had low vitamin D levels, they're showing higher death rates. It is a very small study, not very great evidence, so there's going to be larger studies that are going to spin off of this. But it's good, and it is logical that that would be the case, given what we know about vitamin D. The other supplement that I recommend is vitamin C. Vitamin C at 200 milligrams per day has been proven to prevent infection. I usually just take 500 milligrams because that's what's easy to find out there. And then it has been shown that once you do have an infection, up to 1 to 2 grams daily of vitamin C helps to decrease symptoms and speed up recovery. So what I normally do is I take my 500 milligrams of vitamin C every day, and if I get sick, I just take 2 of them. And I do that with the kids as well. So those are my biggest takeaways: that hand washing, face masks, vitamin C, vitamin D. And then what we can all do and what we all know about and is super important is just a healthy lifestyle. One of the things that we've been really concentrating on is nutrition, exercise, and good sleep. It keeps our immune system strong and helps us to fight things off. What I've been doing and having the kids do, trying to have the kids do, is to exercise, go for walks. I think it's important for us to increase our lung capacity. This is a virus that attacks the lungs, so concentrating on getting some kind of cardio in a few times a week. I recommend 3 days a week, 30 minutes a time. If you can do 4 at 30 minutes or maybe 4 at 20 minutes, that would be great. It will help with weight loss. It'll also help with your lung capacity and your heart. And while you are exercising, do it at a brisk pace to increase your heart rate and to concentrate on taking nice, deep breaths. This will help if you do happen to catch the virus to help your lungs deal with it. And then one side takeaway that I thought I would mention, because I read a really interesting article and it can't hurt, is instead of taking my temperature every day, I have been using a pulse oximeter. It measures how much oxygen is in your blood. Since COVID is a virus that attacks your lungs, it has been shown that it oddly enough decreases your lung capacity to a point where people aren't noticing it. And when they come in, when patients are coming into the ER, doctors are finding that their pulse ox, or their the amount of oxygen that's in their blood, is low, but they're not exhibiting symptoms. And then at the point in which they are exhibiting symptoms, they need to be on a respirator. So I have been taking my pulse ox every morning, and what is recommended is anything below 90, you need to go to the doctor and let them know that your blood oxygen level is below 90. That's not normal, it's unhealthy, and it's at a point where it needs to be given attention. So with all that being said, I want to thank you for taking the time to listen to my recommendations. I love helping people. If you have any questions, please comment with those questions. Let me know if there's anything you want me to research for you. I will promise to bring forth to you the best evidence that I can find. And if there are any other health and wellness topics that you would like for me to cover, please let me know. Subscribe to my channel. I will be doing several videos regarding nutrition, exercise, supplements, and anything that's big in the news and media that's going on regarding health and wellness. I always look that up, and I will bring forth that information to you. And thank you.